Hello, everyone. My name is Marty Guthmiller, and I am CEO at Orange City Area Health System, bringing you today on Friday, September 18th, the 56th edition of our COVID-19 community briefing. I'm going to go through some statistics and then give a little bit of a narrative as to kind of where we find ourselves today. So Sioux County, jump right in. Again, not Monday, so we don't have a local scoreboard for you. But Sioux County has 1,258 positives of the 6,584 tested. That is an additional 159 since Monday. That is a 19.1% positive rate. To compare to previous times, 17.6, 16.8, 16.3 would be our last 3 times before this. So there's no question Sioux County positivity rate is higher. The other county rate that we've been watching and tracking is the percent positive 14-day average. Sioux County, unfortunately, still remains number 1 in the state at 28.5% as of a few minutes ago. Very high rate, no question about that. Lyon County is second in the state at 23.6%. Plymouth County, by the way, is number 4 at 17.6%. So it gives you an idea. If number 4 is 17% and number 1 is 28%, we're leading the pack by quite a ways, which in this case is not a great thing. Also, there are 31 counties in the state at a 10% or greater positive rate. That doesn't tell you much unless you can compare it to previous times, and it's not a positive trend either. The last time I reported that, it was 23 counties at 10 or more percent, and the time before that, 21. So we've gone from 21 to 23 to 31 counties, and so the increase in 14-day positivity is not just here, but certainly we're accelerating that, no doubt about it. Region 3. 53 hospitalized in the 20 counties in northwest Iowa. Again, 6 regions in the state. The 53 number was compared to 45 on Monday, so we've had an increase of 8 in that 20 county region. 13 in our ICUs in that region. That number was 11 on Monday. 10 patients were admitted in the last 24 hours. So again, in Region 3, not a positive trend again there. Iowa, 76,000 even positives of the 708,029 tested. That is a 10.7% rate across the state, as compared to 10.6 when we last talked and 10.5 the time before that. In terms of hospitalizations, we have 266 was the last number on the coronavirus.iowa.gov website. That number was previously 253, so a slight uptick in the state there. As is the case, we pay more attention to the hospitalizations immediately around us. Very stable in that regard. Sioux County is at 5. And again, I can't emphasize enough, that represents 5 Sioux County residents hospitalized, period. Where they're hospitalized, it doesn't say, but it does give us an acuity measure there by one definition that is good. So it does relay our full county population to being hospitalized somewhere, whether in Sioux County or elsewhere. So 5. And that number previously was 4, so when we talked on Monday. O'Brien County, 4. Lyon County, 0. Plymouth County, 1. So again, in the 4 counties around us, really not a lot of hospitalizations, which is a good thing. Now, what this does not mean is that people are not getting sick. I know firsthand from friends of mine, acquaintances of mine, that this isn't a cakewalk. You know, some people barely know they have it, to other people up to and including pneumonia as an example. So I'm not in any way taking this lightly, but acuity as in measured by hospitalizations and also as in measured by deaths is not going up. We'll talk about deaths in just a little bit. So we are seeing patients who are sick. There's, again, no question about that. But by and large, being able to stay out of the hospital. To finish up with the hospitalizations, Woodbury County is at 20. They were previously at 18, and Polk County is at 43. They were at 41. I did visit yesterday, and by the way, Woodbury County is number 2 in the state at 20. I did a visit yesterday with the CEO of one of the Des Moines hospitals, and he did clearly state that they feel like the cloud is beginning to lift there. And that's good. I mean, it's good anywhere, but also as things have worked in Iowa, they've tended to move east to west. And so maybe that trend will come westwardly soon. So we hope that's the case. In terms of deaths, there have been 36 more deaths this week in the state of Iowa. No additional deaths in Sioux County. We remain at 3. Plymouth County remains at 20. And I believe a lot of the Plymouth County deaths came out of a nursing home environment. In terms of the demographics of the deaths, really not changing at all. 89% are still from the age group 61 and over. 2% are between 18 and 40, and 0% 17 and under. Also, if you look at the trend line, there remains a steady decline in the death rate since September 1. There was an increase from July through and up to September, but since September 1, we've seen a steady and fairly dramatic decline in that, and so that's very positive news as well. I'm going to shift gears now a little bit to a couple other topics, and the first thing is masking and the masking question. I understand why there's probably some confusion out there that the messaging relative to masking has changed. I mean, it's changed over time. It was kind of an ever-changing thing there for a while. Given the community spread that we're obviously in right now, I fully advocate wearing a mask. There's just no ands, ifs, or buts about it. I support mask wearing. One of the things that's very frustrating is that people don't always understand some of the things that happen. The fact that and most people don't understand this or know this because there's no reason that they would. We've had, we being Sioux County and public health, have had a state epidemiologist review what's going on in Sioux County and try to point towards something. Is there anything in particular? And the epidemiologist has indicated he or she finds nothing that can specifically point to. So it is community spread. I mean, it is pure and simple community spread at this point. And mask wearing is a great way to combat that. In fact, there's been a study out that one theory is that mask wearing actually reduces the viral load that one is exposed to. Mask wearing doesn't capture 100% of things, as we all know, but that it reduces the viral load to the point where somebody is actually ill and may not know it, actually has COVID and may not know it, but yet it's enough of a viral load to build up immunity. So in kind of a different way, mask wearing in some way provides immunity, not from catching it, but from the disease itself. I'm not necessarily advocating that, but this was a legit study. And so it's just another reason to wear your mask. Wear your mask. As the Nike commercial says, just do it. Another thing that we've been dealing with a little bit is some thought that Orange City Area Health System has not taken the pandemic seriously from the very start. To say that really disrespects the multidisciplinary team that has been working tirelessly here since the middle of March under the leadership of Dan McCarty to deal with this and to get us through this. That group, again, multidisciplinary group, has really helped us chart our way through these waters. There have been times in this where, we're taking this information, running it through the common sense filters and dealing with it. We've always followed IDPH, CDC guidelines, and in most cases actually have exceeded those. An example of that is over a couple months ago or so, I don't even remember when it is, we were actually turned into Sanford. The health system was, for not taking this seriously enough. Sanford found it kind of interesting that, of all places, Orange City was turned in, so to speak, and ended up really supporting every initiative that we had undertaken. And in fact, through that process, we learned we do things, we're doing some things in addition to what Sanford is doing. For example, taking temps and screening people at the door. They weren't doing that, we were. And so there were steps taken that we were going beyond what they would even advise their hospitals to do. So, throughout this whole time, we have almost 600 employees that come from 39 different communities every day to take care of people, and have throughout this pandemic. We did not furlough any staff. Safety has always been our number one priority. I'm going to go into a couple of things that we've done that are beyond this. And this isn't meant to be a commercial, but it is meant to be an exclamation for an explanation for what some people think that we don't take things seriously or we don't know what we're doing. With all of that said, it's important to understand that our role in the health system is largely contained within the walls of this building. In other words, we're here to take care of people. We do that 365, 24/7, 365, whether it's COVID related or not. And, believe it or not, 99% of things out there are still not COVID related. There's an awful lot of stuff. By far the majority of stuff is not COVID related. We're here to do that. We're here to take care of your engine, to keep things tuned up, to make sure that those things are being done. We do not create or dictate public policy. We do take guidance from that public policy, as we should, to include the Iowa Department of Public Health, community health partners, the CDC, and others. We'll probably talk a little bit more, and maybe at a future time I'll have ask Kim Westerholm if she'd like to join to, again, talk about the differences in our roles of a health system versus public health. We may follow up with that if that would be of value. I understand people's fears. I have some of my own, believe it or not. I understand that. This is a very difficult time. And the collective burden of COVID after 6 months is manifesting itself in many different ways in many different people. Whether it's an irresponsible comment verbally, whether it's a comment made on Facebook that maybe you wished you didn't make, whether it's a comment made to a friend, whether it's something at church going on, it is clearly manifesting itself in many different ways, and we need to be aware of that and guard against that. We're dealing with a virus that was virtually unknown to us 6 months ago, and has changed, over time too. And the one thing, again, that we want to point out is that as a community, as a region, we've been able to largely protect the most vulnerable people. And that is in our 61 and over group, but really probably in the 65 plus group, maybe 70 is a little more accurate. But we've been largely able to protect that. And thank you to everyone who's been wearing their mask, practicing a good social distancing, doing hand hygiene, and all of that for keeping our seniors safe. Social media is a forum that not only can share concerns, ideas, and experiences, but also in some cases is used to cast judgment and blame. It's always kind of amazing to me the certainty, the feelings that are being expressed within the context of the author not having any responsibility at all for actually caring for people. It's a little bit easier to sit behind that keyboard and type something without any responsibility for dealing with it in a caring, compassionate, and skilled manner. I think we have to be really careful these days on inciting fear, on creating division, and using Facebook as a weapon in that regard. Now, with that said, there's nothing wrong with questioning something. The questions that are appropriately answered are addressed in this forum. It's fine to ask questions. It's fine to challenge things. One thing that I've said from the very beginning is that the only thing that we know for sure is that we're not going to get everything right the first time, but we are going to try. We are going to stay in the game, and we are using the parameters that we've discussed to navigate our way through this pandemic. We're doing some things that are well beyond what we've been expected to do. We've spent roughly $250,000 on things like UV light disinfecting system, Clorox 360 hydrostatic kind of stuff that cleans rooms in a thorough way, various analyzers, building negative pressure rooms in our ER, expanding the number of rooms in our ER, expanding negative pressure within our med-surg floor in the hospital, and having negative pressure capability in our nursing home when and if we need it. All of that is well beyond what anybody is ever telling us we need to do or is being mandated to do. these are extra steps that we're taking. We've paid payroll of nearly $346,000 in not furloughing staff and in directing staff to deal with COVID-related ways. One of them being calling seniors and making sure that they were okay during the height of the pandemic last March and April. We didn't have to do those things. And then now to be accused of not caring, to not doing what we need to do is really disrespectful of those professionals. People can say what they want to say about me, but when they talk about the people that care for them, when they talk about the professionals that I see working so hard, that really hurts. And I'm not standing by and letting that happen. You know, our folks come to work every day, and you know the hero term is bantered around, and you know, I think sometimes can be overused, but there's no doubt in my mind that the people, our staff that are here, are committed to caring for you. Will be here each and every day, 24 hours a day, armed with the tools that they need. Again, not everything's going to be perfect, but we're going to try to do everything possible to make sure that we take care of everyone, regardless of what time of day, any kind of persuasion that you might be in. We'll care for you, and we want you to know that. I'm going to stop for today. I want you to have a great weekend. I want you to get outside, enjoy yourselves, wear your masks whenever you're out in public. Stay strong, stay vigilant, and stay healthy. Thank you for joining us, and we'll be back on Monday. Thank you.